Roughly 80% of cardiovascular disease is preventable through behavioral changes. Yet heart issues remain an escalating global crisis, placing the organ under physical strain. When the body begins to fail under this strain, it trips a neural alarm system. Physical decline activates the amygdala, the brain's primary center for processing threats. This alarm triggers a surge of cortisol. Elevated levels of this stress hormone physically exhaust the body and suppress the neural pathways associated with positive emotions. This cycle shows the biological trap. Because the brain is suppressing positive emotion, it accelerates the physical cardiovascular deterioration that triggered the alarm, locking the system in a loop. Breaking this loop does not require pharmaceutical intervention. Data from 19 randomized controlled trials involving nearly 3,000 participants suggests a specific zero-cost practice disrupts this biological feedback loop. We're mapping the biological timeline required to take a fleeting feeling, clinically known as state gratitude, and hardwire it into a permanent physiological baseline called trait gratitude. Appreciation, in this clinical sense, is more than a social pleasantry. It acts as a biological circuit breaker required to stop the chronic stress response. On day 1 of the protocol, a patient begins contemplative gratitude journaling. The neurological response begins the moment they identify a specific positive element of their life. The medial prefrontal cortex activates immediately to process the emotion. This signal travels to the HPA axis, the body's central command for stress, prompting it to turn down the release of cortisol. This data comparison shows the shift in heart rate variability, or HRV. The jagged waveform on the left represents autonomic stress. On the right, gratitude increases parasympathetic tone, creating an ordered wave that lowers diastolic blood pressure. By the 3-week mark of daily practice, the brain increases mu-opioid signaling, a chemical process that works to restore biological homeostasis. This shift reconfigures sleep architecture. Reducing pre-sleep arousal and rumination shortens sleep onset latency, leading to more consistent energy recovery. Patients with heart failure show improved medication adherence and better dietary habits at this stage. The shift toward healthy eating and medication adherence is the mechanical downstream effect of disarming the brain's neural alarm system. At the 8-week threshold, a timeline observed in the red wine and Shaka trials, trait gratitude becomes biologically embedded. This shift addresses the biological drivers of cardiovascular decline, inflammatory biomarkers like IL-6, CRP, and TNF-alpha, which facilitate atherosclerosis and heart failure. This graph tracks those biomarkers over 8 weeks of sustained gratitude practice. We see IL-6, CRP, and TNF-alpha plummet from their baseline levels to a stabilized low. This data also shows a concurrent genetic shift. As inflammation drops, lower CD38 gene expression facilitates more efficient oxytocin signaling. In this cross-section of a blood vessel, we see the physical outcome. With inflammatory markers held low, the progression of arterial plaque buildup is suppressed. Secondary metabolic benefits also appear by week 8, including lowered HbA1c and better glucose control. 8 weeks of consistent practice alters blood chemistry and genetic expression to inhibit vascular damage and ventricular remodeling. The ultimate clinical outcome is the development of positive psychological capital, which actively prevents the dangerous thickening of the heart walls. This biological intervention can be initiated tomorrow using 3 methods from the clinical literature. Method 1 is daily journaling. This involves listing specific positive elements daily for 8 weeks. Method 2 is letter writing. Directing appreciation towards others increases the intensity of the neural response. Method 3 is contemplative reflection, using internal meditation to lower pre-sleep arousal and tension. A few minutes a day lowers CRP and IL-6, boosts heart rate variability, drops blood pressure, and restores sleep quality. Providing the heart with a much-needed biological break requires absolutely zero medication. It only takes 8 weeks of consistent, intentional appreciation.